as my dad always said, you're not taking care of a tooth, you're taking care of the person connected to that tooth. And until you get to know them and understand their life and what's going on in their life, you really can't find out how to really treat them and solve their problem. All you're doing is drilling, filling, and billing, and that's not what dentistry should be about. Dentists graduate right now with anywhere between $300,000 and $600,000 in student debt, and when insurance reimbursement rates are so low, they can't afford to go buy into a private practice when they're pushed towards corporate employment. So we're losing really a generation of independent dentists before we even start.
Welcome to Into the Desert, exploring the wilderness of ideas. Don't forget to hit that like and subscribe button. And if you'd like to support our channel and our mission of encouraging discussion, not division, please join us on Patreon. The link is in the description. I'd like to welcome Dr. Robb Warren to our podcast. He is the owner of Warren Family Dental. Dr. Robb has been a dentist in the state of Wisconsin since 2001, and he's earned his doctorate degree from Marquette University of Dentistry. He is a longtime active member of countless dental organizations and organizations that donate dental care. He provided dentistry services for the University of Wisconsin Athletic Department. He donated dentist office equipment for the nonprofit Affordable Dental Care Clinic in Madison, which serves those without insurance at half the cost of the national dental fees. He won this year's 2025 WDA Foundation Philanthropic Award. He is the dental director for the Special Olympics of Wisconsin, which does an annual free clinic for athletes. He works in the University of Wisconsin Hospital, part of the on-call dental team. He is one of my favorite dentists, and I was one of his first patients when he came here to Madison. And I just really appreciate all the work that he has done, as you can see from my beautiful teeth. He does great work.
Thank you for that wonderful introduction.
You're welcome.
Yeah, well, thank you for joining us. So Dr. Robb, I know there's been a lot of changes in the last 24 years since you've been a private practice dentist, and with some really big changes in the last few years. And you've had to make some hard decisions on how you practice and what choices you have to make. So how have these changes affected your business? What decisions do you face each and every day in managing both patient care as well as keeping it affordable?
Yeah, no, it's a great question. My dad was a dentist for over 50 years, and I've been doing it now for almost 25. And there have been a lot of changes, some for better, some amazing technologies that are available, amazing resources, some great research out there helping us do a better job. And one of the challenges, though, has been just the cost of doing business. And one of the big negative impacts has been the cost with insurances, or really the lack of reimbursement for insurance companies. And so they've really started trying to dictate more and more care based off patients won't do care if insurance doesn't cover it. And so as those insurance reimbursement rates don't keep up with the pace and cost of doing business, it's making it more difficult for us to take care of patients the way we need to and the way they deserve to be taken care of.
How's that come to a head in the last few years?
Well, basically over the last 10 to 15 years, groups like Delta Dental have not kept up with the pace of inflation. And so with the cost of new technologies and materials and staff wages, compliance costs are just going up so high, and the reimbursement rates haven't followed. And so it makes it very difficult. A lot of dentists feel the need to have to either shorten appointments or to limit services they can offer, or in some cases have to go with cheaper materials just to be able to stay in business. And that's just it's not sustainable. It's not what's best for the patients. It's what's best for insurance companies. And so dentists are now starting to stand up for that care for their patients.
Can you give me an idea of how much they've fallen behind? I mean, in the last 10 to 15 years versus what they reimburse today?
Well, you can actually go all the way back to when they first started dental insurance in the 1960s. You were given $1,500 for your maximum benefit. And that number was chosen because at the time, that's what it cost to have all your teeth taken out and a set of dentures made. And nowadays, the cost just for the denture alone can be around $1,500. And so, and even, again, back then, the cost of a crown was maybe $150 to $200, and now it's $1,500 a crown. So just the maximum allowable care has not increased with the services. And so that's probably the biggest part, is that at this point in time, for example, Delta Dental, among others, takes 35 to 40 cents of every dollar out of the fee to match what they feel the fee should be. And that's how much we lose off of every patient that we see. You lose pretty much 40 cents on the dollar for every patient you see in your office if they have insurance.
So I know you've had to make some really tough decisions over the past few years of what insurance you're going to take and which ones you're not going to take. And I know you've slowly been dropping insurance companies. And I know this year you really kind of have to make the big decision on what to do about Delta Dental, which is, I know most of your patients are with Delta Dental. How do you make those decisions? How do you determine the losing 40 cents per dollar versus how many patients you might actually lose if you're no longer in network?
Yeah, the big thing is it really comes down to we want to get the focus back on the patient. So what's happened is instead of really focusing on what's best for the patient, practices often have to focus on what's covered. And then it's not really the doctor deciding what care should be done. It's the insurance company deciding what care should be done. And so to get back to that, it's basically having to go out of network with the insurance companies. So you can still come. It's not like we're dropping the insurance. You can still come to the office as a patient has that insurance. It's just the coverages and what the reimbursement changes from the insurance company in terms of being an out-of-network provider versus an in-network provider. And so there's a lot of dentists doing it across the state. It's been a trend the last couple of years, and more dentists are choosing to go out of network. So we currently are out of network with all insurance companies except for Delta Dental. And that has been kind of the elephant in the room. A lot of dentists have been afraid to go out of network with a lot of insurance companies, including Delta, because of such a large portion of their patient practice are Delta patients. For example, for me, we have 4,300 active patients, and 3,000 of those are Delta patients. So you worry that if you go out of network, Delta will send a letter right away letting them know that, hey, they're no longer in network, and then send you a list of providers they want you to go to being in network. So they're immediately taking patients away from your practice.
Yeah, I'm assuming that's an even bigger thing now that they've started to open up their own dental offices. I know that there was an article a couple of months ago, and I know the WDA has been having a lot of conversations about, should this even be allowed? What are the regulations with Delta Dental basically being the beginning and end of patient care?
That was kind of my, I don't want to say breaking point, but when I finally felt like I needed to stand up and do something, because it's one of those things that when you also have the insurance company that owns the dental practice, it really blurs the line between the payer and provider. They're basically setting the reimbursement rates, and they're also controlling the delivery mode. It's kind of like when a referee starts owning the team. It's not really necessarily a fair game. And it's hard to trust a system where the people who set the rates also own the chairs. I mean, there's lots of different ways to paraphrase and look at it, but it's frustrating for the dentists that now all of a sudden, if I choose to go out of network with Delta Dental, they own a practice down the street. They're just going to tell their patients, hey, go over there and come see our dentist. And it's not how it should be.
You mentioned that you and your dad have been career dentists for a very long time. How's it affecting new dentists, those who are just coming out of school and getting ready to start their practice? How's their experience today different from what yours and your dad's were?
That's a great question. Dentists graduate right now with anywhere between $300,000 and $600,000 in student debt. And when insurance reimbursement rates are so low, they can't afford to go buy into a private practice when they're pushed towards corporate employment. So we're losing really a generation of independent dentists before we even start. And the other big thing you lose is the mentorship. The traditional pathway is basically where you would buy from a local dentist and learn from anywhere from a couple of years to a decade or more. And you learn how to serve the community and take care of the patients. That's kind of going away. Mentorship is not really about metrics. It's about building great doctors. And that's kind of, again, being taken away when dentists coming out of school can't afford to go to a private practice. They have to go corporate because of some of the bigger salaries and bonuses they lure them in with.
Yeah, I can't even imagine. I mean, to spend that much money to go to school and then have to work for a corporation your whole life, it just seems backwards to me.
Well, it's hard because I don't want to make groups like Delta Dental or any other dental insurance out to be a monster or out corporate dentistry is all bad. There's a lot of wonderful, great practicing dentists that work in corporate dentistry and work for large groups of dentists, and it just really starts to limit the ability of overall as a group those dentists I've heard from again and again, they're told about different supplies they can or can't use, or they're told about quotas they have to hit in terms of how much production they have to make. To give you an example, one of the offices nearby me actually gets a higher reimbursement rate for what the insurance company pays them for crowns because they submit more crowns. So they're basically, insurance companies are incentivizing you to do more dental care to get better reimbursement rates when maybe that's not really what the patient needs. And so that's the other side of the corporate thing that I don't really love to hear about, is that, again, patients should be given choices. You should give them the autonomy to decide what is best for them. And it's not for me to decide what's best for them. I can give them options and make recommendations, but it's their healthcare and their oral health. And so they need to decide and have the freedom to choose, not say, well, this is what insurance covers, so I'm just not going to do that, even though it may be the best thing for me, or even long-term would prevent other problems. Going for the cheapest route is not a great model for dental care or for healthcare in general.
So I'm not a dentist. I'm an engineer. If I go to the doctor, I feel like I'm fairly unique. I'm not going to be a cookie cutter to the previous patient or the next patient. I assume it's the same in dentistry.
Correct.
How unique is it from patient to patient? And as a follow-up question, how practical is it for dental insurance to say that this is the exact amount a crown should cost? How much variability is there really from patient to patient?
Yeah, there's a couple different parts to that question. Is that one of the challenges, again, with having lower reimbursement rates is all of a sudden one of the solutions is to shorten appointment times. A lot of hygiene appointments get cut back from an hour to 45 minutes. Doctors are forced to try to get more care done in a shorter amount of time. And so you don't get to spend as much time with patients. And that's one thing I've really, again, vowed never to allow to happen, is that my new patient exams are 90 minutes. It's not in a hygiene appointment for 5 or 10 minutes to see the patient for the first time, because everything is so unique. Every patient we meet has a different situation. You look in their mouth and everything may seem okay, but then you find out they have head and neck issues or headaches or migraines or swallowing problems or snoring issues or breathing issues. And you can start throwing solutions at them in terms of trying to treat the symptom. But if you really want to treat the root cause, you need to spend time and really get to know the person. As my dad always said, you're not taking care of a tooth, you're taking care of the person connected to that tooth. And until you get to know them and understand their life and what's going on in their life, you really can't find out how to really treat them and solve their problem. All you're doing is drilling, filling, and billing, and that's not what dentistry should be about. It should be about connecting with the patient and finding out, why are they stressed? What's going on in their life? Is that something that we can help with in terms of getting them to a point of where they are relaxed or where they can actually breathe properly, so they don't have a higher anxiety level, so they aren't grinding their teeth and then breaking down fillings and crowns. There's just so many nuances that are connected to each individual patient that it's just the bottom line is you need the time to connect with the patient.
Yeah. Have you ever considered joining a large corporation?
I get calls and emails on a weekly basis from private equity groups coming in. There's a number of groups here in town that have actually sold to private equity. And there's some specialty offices that have done the same, as well as general dentists. And the hard part is you don't know who owns your office, or really who owns your dentist. There's offices in town that all have different names, but all owned by one person. There's corporate groups that have come in. There's a group out of New York that came in and bought a bunch of dental practices here in town. So all the profits are leaving the state. But it looks like they're independently owned because that's how they market it on their website. And so it's really tough because we continually get patients from those groups that say they just feel like a number. And so that's why, again, I can't ever see myself going that route, because it's really about, building that trust and helping out in the community and serving the families over many decades. And my dad taught me to do two things in being a dentist. Take care of your team and take care of your patients. And if you do it better than anybody else, if you do those two things really well, success will follow. In a corporate dentistry, it isn't always the approach. It tends to be more about quotas and money and keeping the overhead low and, as I say, quality over quotas. And so that's just, it makes it difficult to go that route with the way corporate dentistry has started to go.
Yeah, and speaking from someone who's been to both, a school of dentistry or the corporate dental office, and obviously going to you, there's a huge difference in the way I feel in going to those appointments and the type of care that I'm getting. And in the big name dentist offices, it's not the same, which is why I love going to you so much.
Well, thank you. Yeah, it's something for us we take pride in. It's one of my favorite appointments is our new patient exam because I hear again and again, patients say it every time. They're like, I felt like I was waiting forever to get into you, but yet when we got here, it was worth it because I learned things I never knew about my oral health or why for years I've had a hard time with, I keep breaking crowns or why I've been having all this jaw pain or why I keep having bad breath. And if you can get at a reason why those things are happening, you can treat them, and it's life-changing dentistry, and that's really what we're able to do with because we have the time to take care of our patients.
Yeah. Is there a difference between being a specialist, like an oral surgeon, or handling a special area of dentistry, or, what you do in just being a general practitioner?
Yes, there is. There are some specialists in a number of different areas, whether they only, they focus on doing root canals or focus on placing implants or taking out wisdom teeth, pediatric dentists that focus on taking care of children, periodontists that focus just on the gum tissue or on also placing implants and periodontal health, prosthodontists that just do dentures and fixed dental appliances and fixed crown and bridge care. And the great thing about general dentistry is we have the ability to do all of it, and we can decide in terms of, for example, my approach towards it is if I don't feel comfortable doing it in terms of if I get myself into a challenge situation, I can't get myself out of it, or if I, for example, would I be willing to do this work on my mother or my brother or my sister and feel safe doing it, then it's time to refer to a specialist because there's some wonderful specialists out there that do some great work. And yet it's nice to have that flexibility to do, kind of take care of the whole patient. Which is why, like, again, for me, I tend to focus, every dentist kind of has an area they love to focus on. And for me, it's TMJ and trauma and airway. That's why I have the jobs I have with the University of Wisconsin and working at EW Hospital. And so, for me, that's kind of my focus is treating the TMJ and the airway, which then in turn can help treat the body and the patient as a whole. But it's nice to have that freedom to be able to do that.
Where do you see dentistry going, and what are your biggest concerns for the future?
That's a really good question. It's one of the challenges we've talked about in terms of there's some phenomenal technological advances that are coming through. For example, the use of scanners and 3D scans, the use of computed cone beam technology and computed tomography or CBCT, having that kind of technology available to be able to assess patients beyond just two-dimensional imaging has been phenomenal and has been hugely impactful in our practice. And AI is another thing that's starting to come about, using it on x-rays and helping diagnose things maybe you weren't looking at or couldn't quite see or didn't recognize, giving another set of eyes. And on the other side of that, the challenges come into play is that AI isn't always right. And so you can't just assume the technology knows what it's doing. It's only as good as the data you put into it. So you got to watch for things like false positives and not just rely on the technology. In terms of practice as a whole, it right now is making a big shift towards large group or corporate practice because the solo practitioners is becoming more and more unsustainable. And so that is something we all worry about, especially through the WDA and as different study clubs we private practicing dentists have, is that it's taking away from the patient care model. So I do worry that they're going to make dentistry less and less accessible to everyone. And we already have a challenge with that. Half the population doesn't even go see a dentist because of how they've been treated, because of they feel like they weren't taken care of, quite often because they were rushed into care or hurried into care. And so they don't feel like they're going to be taken care of. So why are they going to volunteer to go into a practice for that, not recognizing that prevention in oral health could be life-changing. There are major issues in oral health with inflammation, periodontal disease, and so it's the patients who could actually treat that inflammation. They could decrease the risk of heart attack, decrease the risk of stroke, decrease the risk of lung infection. And if we can't get patients into chairs and there aren't enough dentists to be able to be seen, it's going to be not just a dental oral health crisis, it'll be a national health crisis overall. And that's my biggest worry. overall. And so we need to find ways really to combine the medical and dental care. If there could be a way to have dental covered under medical, it's the only part of the body that is not covered under medical insurance. And so it is always going to become this, I want to call it the ugly stepchild of medicine, that you just don't include it in taking care of the body. And it's a major part of having a healthy body. So I think if we're going to fix the healthcare crisis in the United States and access to care on the healthcare side, it needs to include dentistry, or this problem will continue to just get worse.
One follow-up on that.
Yes.
Why is there a difference? One of the things I've kind of wondered is, why are dental insurance and health insurance different? Are there laws that keep them separate?
Well, dental insurance, to be honest, isn't really an insurance, and that's the problem with it. It's with how people look at it. Patients see it as insurance, like healthcare insurance, and it actually isn't. It's really just a benefit. You get $1,500 a year to help cover as a benefit to cover your costs, and patients are expecting to be more like healthcare insurance that covers, the major surgeries and covers tens of thousands of dollars a year. It can cover a $40,000, knee surgery. And they're expecting that same kind of thing when it comes to dental surgery and dental care. So it's not an insurance. It's really just a dental benefit. And it's been treated as such by the insurance companies, which I think, again, is also part of the misleading part. The insurance companies are the ones administering it, but they only give you $1,500 a year as a benefit. It's not really any sort of insurance coverage.
Yeah, it's kind of like eyeglasses. You get $150 for glasses, and that's about it.
Yeah, and eye care, chiropractic care, some of the other medical professions that don't get a lot of love under healthcare insurance. It's difficult, which is, again, why we've decided not to let insurance dictate how we care for our patients. And that's really the direction dentistry is going, is that we need to focus on patients first, what is best for the patient, what is best for preventive care for the patient, and not just be problem focused, not just wait till they show up with a problem or wait till they show up with pain. Really focus on prevention, because that's where success in dentistry can be found, in the prevention side of things, to create not just healthy mouths, but healthy patients.
Yeah, and well, you're kind of nice. You offer it's kind of like your own insurance discount club thing. Have you ever looked at expanding that?
Well, yeah, and you got to be careful calling it insurance, because we don't have any sort of insurance program we offer, because there's actually, again, it would get into the same kind of concept. If I'm offering insurance to a patient, then it's just as bad as Delta, also owning the practice and offering it. So it's actually more of what they call it a membership plan. So it's basically giving you, for example, for us, there's a set fee that covers certain costs throughout the year, and then you get 15% off of other major care. So it's kind of just trying to find a way to help save some money on it, so that you're not having to pay a full fee on it, but still allow you to get the full service and get the full care that you deserve.
So how does the U.S. compare with the rest of the world, like Europe and maybe in Asia? That's
a really good question, and a lot of that does come down to the healthcare model. In other countries, especially, we always compare ourselves to Europe, you can walk in to a clinic and the care is covered, to have a filling done, to have the restorative care done, the basics and preventive care taken care of as part of just being a citizen of that country. And I can't really speak to exactly how the program itself works. I do know that then when it does come into what's considered to be elective care, there are some challenges there in terms of what's considered elective versus what is considered to be a basic covered procedure. And I don't even look as much at that side of it. I look more so at the numbers from a standpoint of overall, from having a healthy population. I know that the U.S. is woefully low in how they rank compared to other countries in terms of overall oral health and level of dental health issues. I mean, the number one reason that children in the United States miss school is because of dental health issues. And adults are right up there as well in terms of the number two reason I believe for them as to why they also miss work is for dental care and dental visits, because they have a lot of things that cavities and things like that could be 100% preventable.
Yeah. So being that dentistry is such a big impact on our general health, how much of dentistry is or could be covered through your health insurance?
Minimal. There are sometimes, if some surgeries are for mostly oral surgery things in terms of impacted wisdom teeth, major trauma issues, having a major jaw surgery itself or facial reconstruction surgery, that would be covered under medical insurance. But otherwise, anything I do in a general dentist office, there's zero medical coverage. Again, TMJ and airway issues, there's zero coverage in dentistry for it, and medical is also very limited. Each arena seems to think it's the other person's arena to take care of, and therefore patients kind of left hanging in the balances with really no coverage for it at all.
Well, thank you so much, Rob, for joining us. We really appreciate this conversation. Thank you.
Thank you.
Absolutely.
And if there's any other final notes you'd like to add?
No, I think that's the biggest thing I would say is I really believe that the dentistry is built on relationships and getting to the patients and not on any sort of quotas. And when the insurance companies start owning a dental practice and setting rules for anybody else, we really risk the personal connection that we can have with patients and the clinical independence that really defines healthcare. And I really want to focus on a practice that honors my patients and my team and a calling to serve with integrity and compassion. I think there's a lot of general dentists that want to be able to do that. And that's really what we're fighting for. And we want to help fight for the patients so they can also stand up for themselves to get the best care they deserve for their long-term health.
So what do you think? Do you think the changes in dentistry are positive? Negative? Do you think corporatization is a good thing? Let us know in the comments. We'd love to hear from you. We do read and reply to many of the comments. So if you made it this far in the video, consider watching some of our other videos and supporting our channel on Patreon. We can use the help. Thank you for watching Into the Desert, Exploring the Wilderness of Ideas.